All right, good morning, friends. Where are you viewing from? I am CC Natural Therapy, trying to make you take in charge of your health from home. So we are about to treat the same topic, menopause. And this time, because of the challenges associated to menopause, I want us to understand that there are several types of menopause. You understand? Because you see a young girl in her reproductive age not seeing her menses and the rest of it, and it has lingered up to 6 months. You can see a woman that just gave birth, you understand, either having secondary fertility issues. Before you know it, she's under the pressures of menopause. So now let's break down several types of menopause. All right, there are natural menopause. Natural menopause occurs when a woman's ovaries stop producing eggs and hormone level decreases seriously, typically because the age of 45 and 55. Did you get me right? I said the natural type of menopause. We have natural type, we have premature menopause, we have several menopause. You understand? We have types of menopause, about 4 of it. But then before that, understand this natural menopause. I said that natural menopause occurs when a woman's ovaries stop producing eggs and hormone levels decrease. Typically it's between the age of 45 and 55. Then we're talking about the premature menopause. Okay, this premature is the premature ovarian failure. What do I mean? Premature menopause occurs when a woman's ovaries stop functioning before the age of 40, resulting in menopause symptom. That is when we can actually add up that idea I said about a woman who have her child, have your child, she has given birth in her first stage, and after some years having the second or third issues, it's having a lot of challenges, it's bringing forth a lot of problems in her health and the rest of it, even the ovulations and the rest, and menses, a lot of complications sets in. When that occurs, we call it premature menopause. Okay, so at this point, understanding there is something we call failure of ovaries being able to produce menses, when the ovaries are stopped functioning before the age of 40, resulting to menopause symptoms or effect. There are other menopause you can actually think of. The early menopause. When we talk about early menopause, it occurs when a woman enters menopause between the age of 40 and 45. This time might not be because she wants to take in, it's just that the symptoms keep on approaching because she has stopped giving birth. She's already done, but she's not supposed to be in her menopause at that age. At that point, we call it early menopause. The other one here, a menopause that can actually be induced. What do I mean? Menopause can actually be induced because of surgical issues. Induced menopause occurs when a woman's ovaries are removed or damaged, okay, resulting to immediate menopause. Do you know that surgery can actually cause that? Once there is removal of ovaries as a result of certain complications or issues in order to save the life of the woman and reduce her risk of cancer, these are what we call induced menopause. Another type of it is perimenopausal type. This perimenopausal type of menopause is the one that has a lot to do. Okay, this is the type that have to do with the transition. Perimenopausal is the transition period leading up to menopausal typical this menopausal that actually lasts for 2 to 10 years. During this time, hormone level fluctuation sets in and menopausal symptoms may begin. All right, so we have postmenopausal type of menopause. This type of menopause is the stage after menopause when a woman has not had menstrual period for 12 consecutive months. These are postmenopausal symptom or postmenopausal type of menopause. Another one is the chemical induced menopause. What do I mean? Chemically induced menopause occurs when certain medications such as chemotherapy which damages the ovaries and induce menopause. Chemotherapy that is associated to cancer treatment. Those chemotherapy can actually induce menopause, and that is another part that we tag as type of menopause. Okay, we have radiation induced menopause. What do we mean by radiation induced menopause? Radiation induced menopause occurs when radiation therapy damages the ovaries and induces menopause. Okay, each type of this menopause has its unique characters and understanding. The difference on it can help women better navigate this significant life transition. But in all, I want us to understand that menopause is not actually supposed to be a problem because it's something we owe the nature. But when it sets in before the time, help and consult your health professional, meet up with the consultant, meet up with the physician that is taking care of you. Always make sure you are in contact with him to help you stabilize yourself, to make your psyche stable and remove mental stress, psychological stress that is associated to menopause. And so doing, it will help you understand that you can live your normal life without having challenges. Understand today there are different types or several types of menopause. The ones induced by chemical, the ones induced by radiation, the ones induced after you must have stopped seeing your menses, which is postmenopausal states. Okay, understand the natural menopause, which happens between 45 and 55. Understand the premature menopause, which can actually cause as a result of ovarian failure because the ovaries have stopped working before the age of 40, resulting to menopause. And other early menopause, which can actually set in because of certain deficiency or certain surgical operation, as your doctor have been able to remove the ovaries in order to help you. So those are parts you need to understand. So whichever one you're actually facing as a challenge, your health professionals are there to help you. We are there to help you. You can click in, you can ask your questions in the chat box and we'll be able to ask you. You can call us on our WhatsApp numbers, you can chat us up, we'll be able to give you certain understanding you need so that you'll be able to navigate any challenge that sets in. Thank you as we continue listening and remain blessed.